Good day, ladies and gentlemen, and welcome to today's Opioid Misuse and Addiction in the Hoosier Workforce webinar. All lines have been placed in a listen-only mode. You can submit a question through the webinar by typing it into the chat box located on the bottom left-hand side of your screen. If you should require assistance throughout the conference, please press *0 on your telephone keypad to reach a live operator. At this time, it is my pleasure to turn the floor over to Julie Haldig. Ma'am, the floor is yours.
Thank you. Good afternoon and welcome to this third in a series of 4 webinars from the Alliance for a Healthier Indiana for Indiana business leaders. Indiana faces a wide range of health challenges and we rank 38th out of the 50 states in overall health. Today we are going to be focusing on one of our top concerns, opioid misuse and addiction, and how it impacts our Hoosier workforce. We have a great set of speakers today from the public, private, and nonprofit sectors to share their perspective and what you can do to be part of the opioid solution in our great state. Before we dive into today's topic, I wanted to share a bit more about who the Alliance for a Healthier Indiana is. The Alliance was started roughly 3 years ago to address some of our state's top health challenges. We represent some of the leading health and business organizations in our state, and our founding members include the Indiana Hospital Association, the Indiana Chamber of Commerce, Indiana State Medical Association, Anthem Blue Cross and Blue Shield in Indiana, and the Richard R. M. Fairbanks School of Public Health. Any organization concerned about Hoosier Health can join the Alliance on our website, www.healthierindiana.org. More to come on how to join later in this webinar. As I mentioned, Indiana has some very alarming health rankings. Among our top concerns are drug deaths, obesity, smoking, and infant mortality. All of these problems are exacerbated because we are 49th out of the 50 states in spending on these causes compared to other states. At the Alliance, our position is that if Indiana can be top 10 for business, we can be top 10 for health too, with the right focus and attention. Tobacco use is the heart of so many of Indiana's health issues and our top priority to address in the next legislative session. Tobacco use remains the #1 preventable cause of death in our state. Thousands of kids get addicted every year and it costs our economy $7.6 billion each year. Our top priority, broadly supported by health, business, and community leaders across our state, is to raise the cigarette tax by $2 per pack. Raising taxes on cigarettes is the most effective way to reduce smoking and raise new revenue for urgent public health causes in counties across our state. So without further delay, let's get right to our wonderful speakers for today's webinar. Jim McClellan is the Executive Director for Drug Prevention, Treatment, and Enforcement for the state of Indiana. In this capacity, he has a unique role in coordinating and advancing our state's understanding and response to the opioid crisis. Jim has a distinguished career in the nonprofit sector, including as the longtime President and CEO of Goodwill Industries of Central and Southern Indiana. Leah Tate is the VP of Human Resources for Belden, Inc. Belden is a leader in the signal transmission industry and one of the largest employers in Richmond, Indiana. She will speak today about their much-lauded Pathways to Employment program, an innovative private sector-led response to the opioid crisis done in partnership with health and community leaders. And finally, Jennifer Fair is the Executive Director of the Wellness Council of Indiana. The Wellness Council is helping Indiana employers navigate and respond to this crisis with their Indiana Workforce Recovery Initiative. We will hear more from them today about these efforts. And with that, I'll be turning it over to Jim. Thank you.
All right. Thank you, Julia. What I'm going to do is provide a broad overview of the opioid crisis, what we're seeing, what the state is doing, and how others can help. I think it's important for us to have at least a broad general understanding of the overall picture so that we can better understand how we might respond. Last year, over 72,000 Americans died from drug overdoses. About 49,000 of those involved opioids, and over 1,700 were from deaths to people in Indiana. We have one of the higher death rates from drug poisonings in the United States. This chart shows the drug poisoning death rates in various counties. You can see there's quite a wide spread. Scott County is the highest, and Hamilton and Elkhart are the lowest on this chart. Generally, there was a study at Syracuse University. It was published in the American Journal of Preventive Medicine earlier this year that compared. It looked at 500,000 drug-related deaths from 2006 to 2015 and compared them, this is across the country, and compared them county by county with various social and economic factors. And what they found was that counties with higher economic and family distress tended to have higher rates of drug overdose deaths. This is a naloxone heat map. It's now available on our website, in.gov/recovery, that shows where naloxone, brand name is Narcan, that's the reversal agent for an opioid overdose, where naloxone has been administered by EMS. This particular map shows year to date. If you look at a portion of central Indiana, we've got the Indianapolis metro area in the middle, Terre Haute on the far left, and Richmond on the far right. You can see that it's spread out all over the place. Heavier concentrations, certainly in urban areas, but even looking up at Hamilton County, you can see a fair number of administrations of naloxone there. I will say that we are seeing some encouraging signs, including visits to emergency departments for drug overdoses, down somewhat this year, which is one of the hopeful signs that we're seeing. I'll talk a little bit more about in a few minutes. Drug poisoning deaths cover a wide age distribution. Basically, this is affecting people of all ages and certainly all socioeconomic groups. And we don't want to forget the effect on children from this epidemic. Children who are being removed from their homes because of parental substance abuse, that is a factor in well over half of all cases where children are being removed from their homes by DCS. Parental substance abuse is also a factor in 2/3 of all child maltreatment cases. And then, of course, we have kids who are losing parents because parents are overdosing and dying. And we've just got to keep in mind that as a society, we really need to make sure that we do enough to help mitigate the impact on all these children, or we and those children are going to pay a really heavy price a few years down the road. Now, how did all this happen? How did we get there? There was a piece that was published in the Indianapolis Star last month, and it was written by the editor of the editorial page of USA Today, who had lost his 31-year-old son last November to a drug overdose. And he wrote what is one of the clearest and most concise descriptions of what's been going on that I've run across yet. I want to read just a couple of paragraphs from that piece. You can think of the epidemic as a tragedy in 3 acts. In the first act, drug makers, distributors, and doctors flooded the United States with prescription painkillers that were far more addictive than the manufacturers claimed. And he puts in parentheses here that we think Scott's first exposure to opioids came during college when he was prescribed painkillers after an incision to remove his appendix became infected. Now, in the second act, many people addicted to OxyContin and similar drugs switched to heroin, which was cheaper and gave a better high. In Act 3, the pain pills and heroin were increasingly spiked with illicit fentanyls, powerful synthetic opioids manufactured mainly in China and Mexico. And the lethality of these fentanyls explains why deaths involving opioids increased 16% last year, even as prescriptions for painkillers were going down. Now, until about 4 decades ago, addiction was regarded as a character flaw or moral failing. Today, addiction is recognized as a chronic brain disorder marked by people losing control of their drug use and then losing control of their lives. There are 3 things that we want everyone to understand about this disease. First, it is a disease. Opioid use disorder is a disease that has affected the structure and the function of the brain. The good news is there's treatment and recovery is possible. So what's the state's approach? Well, we developed about 1.5 years ago a strategic approach to this. and we have two goals. One is to help as many people as we possibly can who have a substance use disorder achieve and maintain recovery so they can become or return to being productive, contributing members of their communities. And the second is to take steps to substantially reduce the likelihood that we will ever again be faced with a crisis of this magnitude arising from the use of any addictive substance. Now, underneath those two major overarching goals, we have four really high priorities. One is to obviously do all that we can to help keep people alive. A second is to greatly expand timely access to medication-assisted treatment, and I'll talk a little bit more about that in a minute. A third is to take steps to substantially reduce the potential for others to develop substance use disorders. And then fourth, we must do a lot more to educate and inform the public and reduce the stigma that is so often a huge hindrance to effective harm reduction and treatment efforts. Now let's look at a little bit more closely at the role that prescription pain medications have played in this crisis. And you can see from 1999 to 2010, the green line is the rate of opioid sales, the red line is the rate of opioid deaths in this country, and the blue line is the rate of admissions to opioid treatment programs. As you can see that they paralleled each other pretty closely over that 10, 11-year period. But then over the last 5 years, we've seen this alarming spike. It's just an incredible increase in deaths involving synthetic opioids, primarily fentanyl and an ever-changing array of fentanyl analogs that are now laced into heroin, other substances, or even pressed into counterfeit pills that look like prescription pain pills. This is what's been killing so many people over the last several years. Americans consume far more opioids than any other country. With about 5% of the world's population, we consume about 85% of the world's opioids. And if you look at Indiana's rate, in 2016, we had the 11th highest opioid prescription rate in the nation. It was 26% higher than the national average. Now, I mentioned a minute ago medication-assisted treatment. And what that is the use of one of three medications that have been approved by the FDA for treatment of an opioid use disorder in conjunction with behavioral therapy and counseling. Now, each of those drugs works well for some people. None of them works well for everyone. They all have their pluses and minuses. But studies of medication-assisted treatment involving methadone or buprenorphine have shown significant reductions in overdose deaths, illicit drug use, criminal activity, and as well as improvements in health status, functioning, and quality of life. On the other hand, treatment without medications has only about a 6% success rate. So medication-assisted treatment is the gold standard. There was another study that was published by the National Institute of Health of over 17,000 adults in Massachusetts who had survived an overdose and received medication-assisted treatment, and those who were treated with methadone showed a one-year all-cause mortality reduction of 53%. For those with treated with buprenorphine or Suboxone, 37%. There's a third drug, naltrexone, in its injectable form. It's known as Vivitrol, and they have not been able to reach as many conclusions with that simply because of an insufficient number of events. But I think it's also important to point out that 2/3 of all individuals who are receiving methadone at Indiana opioid treatment programs are employed. These drugs, methadone, buprenorphine, Vivitrol, they enable an individual, in many cases, to be able to resume a normal life and function as productive, contributing members of their communities. On our website, there is a link to a portal showing where treatment resources are available in the state. You can open up that portal, put your cursor on the map, and move it around to the area of the state that you're interested in. I did this. I moved it. This one shows the Lafayette area, and on the left of that slide, you can see various treatment centers that are in the Lafayette area. You can click on any one of those and get more information. This particular slide shows the Limestone Health Center in Lafayette, the types of payments they accept, contact information, and what type of services they do provide. There's another resource that's now available with FSA, the Family and Social Services Administration, has modified a software platform called Open Beds linked to the Indiana 211 system so that a person can call and find out where there is an available treatment bed in real time anywhere in the state. Now, recovery supports are incredibly important. I want to touch on this just a minute. Because opioid use disorder is a chronic relapsing disease, and as these drugs tend to hijack a person's brain and affect their behavior, sometimes in ways that alienate their former support group, which may be family and friends, recovery support groups can just be invaluable. We have a number of those around the state. A lot of them are composed of volunteers. A lot of them are faith-based groups. A lot of people in recovery can also benefit from living in a recovery house for a period of time. Recovery houses are for people who are in similar situations and they support each other. They can be extraordinarily helpful. And then we have a number of local coalitions that have formed. They're more forming regularly now. Some of them are called systems of care that can have great impact in helping an individual deal with or be able to maintain their recovery. Now, I've talked a bit about treatment and recovery, but how do we help prevent other people from developing an opioid use disorder? And there are basically two big pieces to this. One is to reduce the number of pills that are out there. We can do that by reducing opioid prescription rates and by encouraging safe disposal of excess pills. The second big piece is to increase the use of evidence-based substance abuse prevention programs for children and youth. Now, our opioid prescription rates in this state are coming down. Not fast enough, in my opinion, but the trend is certainly in the right direction. We just got to keep moving in that direction. But we have to ask ourselves, too, do we really need all those pills? There was a recent study that was done at the Minneapolis VA of 240 patients with chronic back, knee, and hip pain. They treated half of them with opioids and the other half with non-steroidal anti-inflammatory drugs. And interestingly, after 12 months, there was no difference in the pain-related function, and the pain intensity was actually better in the non-opioid group. There was another study that was done at the Dartmouth Hitchcock Medical Center in New Hampshire, and they were looking at individuals who had undergone general surgical procedures as inpatients, and what kind of pills were they taking home with them as they were discharged. 85% were being prescribed an opioid after they went home, but they found that only 38% of the pills were being taken. So they did some more. They collected some more data from patients and established some guidelines. And basically, if a patient had taken no opioids the day before discharge, they didn't receive any. Those who had taken 1 to 3 pills the day before discharge received 15, and that satisfied 85% of their patients. So the reality is that a lot of these pills do not get taken, and unfortunately, a lot of those that aren't end up getting diverted for non-medical use. There are links on our website. Again, it's in.gov/recovery. To Indiana guidelines for prescribing opioids for the emergency department and for the management of acute pain. Safe disposal is incredibly important because 75 to 80% of heroin users start out abusing pain medications, and 70% of those who do so report getting them from friends or relatives, either by buying or stealing them. And there is again, going back to our website, there's a page that has several links to information on how and where you can safely dispose of unneeded medications. We also are encouraging, and we're going to be increasing state support of evidence-based substance abuse prevention programs for children and youth. Some local foundations are making major contributions to these efforts. The Richard M. Fairbanks Foundation, for example, in Indianapolis, and the North Central Health Services, the Lafayette area, and some of the surrounding counties. And there's some local coalitions that are also having significant impact in a growing number of communities. For example, the Alliance for Substance Abuse Progress in Bartholomew County has raised about $1 million locally for evidence-based substance abuse prevention programs in Bartholomew County schools. And then the fourth major priority that I want to highlight here is the need to do a lot more to educate and inform the public and reduce stigma. We launched a campaign last year called Know the OFACs. Again, there's a link on our website, and it's a good place to start for those who are wanting to know more. You know, there's so much data showing how many of our serious social problems in this country are interrelated, and if we only address one piece of a complex set of interrelated issues, we're seldom going to get lasting results. If we want lasting impact, we really need to be working with people holistically, often with the whole family, and with key relationships that last an extended period of time. We need to be addressing issues such as housing and transportation, employment, education and training, child care and development, as well as health care and wellness. And the more we can do this, the greater the likelihood that we're going to have some lasting impact. So what can employers do? Well, for employees and their families, you can educate your employees, encourage them to educate their kids. Be sure your health plans include coverage for substance use disorders, alternative pain management options, and high-quality mental health services. Ensure that your EAP supports people with substance use disorders. Encourage your employees to safely dispose of excess pills. Review your policies and consider launching a program such as Belden's Pathways to Employment that we're going to hear about in just a few minutes. And it's also important for employers to understand what substances drug screens will identify and to be able to differentiate between a positive screen due to illicit activity and a positive screen that might be caused by the individual's medication-assisted treatment, understanding that two of those three drugs that I mentioned a minute ago are opioids themselves, and they, depending on the drug panel that's used, they might show up. What can employers do for the larger community? Well, help provide supports for people in recovery, including recovery housing and jobs. Take an active role in local coalitions that are focused on prevention, treatment, and recovery. Support organizations that provide early childhood development opportunities for kids deemed to be at risk. Support organizations that provide after-school opportunities for kids. Support schools and other organizations that are providing evidence-based substance abuse prevention programs for children and youth. And support efforts to educate the public and reduce stigma. And I would say for individuals, just learn all you can and help educate others about substance use disorders. Support individuals struggling with substance use disorder and their families. Remember that one person has the disease, but the whole family is suffering. Support kids who are affected by substance use disorders and those who are caring for them. Help start or support a recovery house. Volunteer in or provide support for after-school programs. Volunteer in or provide support for early childhood development programs for at-risk kids. Mentor a kid who needs a positive relationship with a responsible adult. And explore how you might contribute to a local coalition that's focused on prevention, treatment, and recovery. Now, I will tell you in closing my presentation here that we're seeing some encouraging signs. We are making progress, but we still have a long way to go. But when we see progress, that's when we know it's time to redouble our efforts, pick up the pace, and get the job done. And with everyone working together, we can and we will do this.
And thanks for those remarks. Just one initial question. Where is the epidemic hitting the hardest? Can you give us a sense of the geographic, racial, age, or other dynamics we are seeing that business leaders should be aware of?
It's hitting everywhere to greater or lesser degrees. As I mentioned a few minutes ago, it is It does affect people of all socioeconomic levels, and it affects people of a wide age range. But areas that have experienced a particularly heavy amount of economic or that are experiencing a lot of family stress tend to be this tends to be more prevalent in such areas. It's everywhere. It's just a matter of the degree.
Great, thank you. And with that, I will turn it over to Leah Tate from Belden Inc.
Great, thank you, Julie. I appreciate you giving us the opportunity to share the program that we have created over the last 12 months. Belden is a global organization headquartered out of St. Louis, but its largest U.S. footprint is here in Indiana. We have one office in Indianapolis, and then we have 3 sites in Richmond. And the program that I'm going to share with you was really developed out of one of our Richmond sites. Our manufacturing environment in Richmond noticed a spike in our failed drug screens, almost a tripling over a 2-year period. And as Jim indicated, Richmond was number 3 in Wayne County on the deaths of drug poisoning on the chart he showed earlier. And so we brought together a group of treatment providers and local leadership in the community, and from those sessions we built a small group of treatment providers. Manpower is a temporary staffing agency that we partner with to staff our operator openings in the Richmond plant, and Ivy Tech has also been a great partner with us as we develop skills for employees within our facility. And so that group came together to develop and put together a framework of a program designed to really provide a second chance employment opportunity for candidates that fail drug screens in our recruiting process. So we get asked the question a lot around why we would invest in a program like this and what's in it for Belden and why is it important to us. For us, it's been a combination of a business need that we identified and our desire to really be a good corporate citizen and make a difference in the community. Fewer people are going into careers in manufacturing, and so we were looking for ways to expand the labor pool versus continue to shrink it. Additionally, the Richmond community is extremely important to Belden. We've been in the Richmond community for over 100 years, so we have generations of families that have worked in the plant, and so we really wanted to find a way to be a part of the solution. So we launched a program in February. We began that session back in October of 2017. We launched a pilot program in February, and we knew it wouldn't be perfect, and we would learn as we go, but we wanted to get something off the ground. And so the way the program works is when an applicant fails a drug screen, we notify them of the program and the opportunity, and they're offered to continue with that employment opportunity if they agree to participate in treatment. They're signing up for completing random drug screening and stay clean as they come on board with us as an employee. So once they agree to participate in the program, they're sent to one of our treatment providers for assessments and a clinical interview, and they're really determining their probability of substance use disorder. And based on that, individualized treatment is recommended, and we determine whether the candidate is able to immediately come into work with us, or they could potentially do an internship opportunity with Ivy Tech. So once they come into the plant, we put them in safety-conscious jobs. Safety is very important to us as an employer, and so we wanted to make sure we were able to maintain a safe work environment. So we put them into safety-conscious jobs, and they're randomly drug screened for a period of time. They have to complete a specified number of clean screens before we allow them to operate machinery, and that number of clean screens is determined by whether they're high probability or low probability. So at this point, we've had 23 people that have entered into the program, 9 of which who have, I'd say, graduated to where they're operating machines. We have 5 currently in safety-conscious jobs. We have 2 in the assessment phase, and we do have 7 people that have left the program. And so that leads into really some of the key learnings that we've had along the way. As I mentioned, we launched a program knowing we would have to learn as we go, but we didn't want to wait. We wanted to begin making an impact and doing something. So I think some of the key learnings or key things that are critical are senior leadership support is really critical to a successful program. Our senior leadership team has been extremely supportive in giving us the freedom and allowing us to create something that works for us. I think it's really important to ensure you establish relationships with strong partners. I'm not a treatment expert, and so we rely on the expertise of the treatment providers that we partner with to help us understand and make sure that we're doing the right things for those employees. We learned early on it's important to ensure that they have the ability to earn a livable wage. It's a vital part of the program. And some of our early people who had left the program were leaving the program because they weren't able to earn a livable wage. We initially weren't allowing those high probability cases to come into the plant and work, and it's really critical to give them something to look forward to, some hope and the ability to earn that livable wage. And so that's been the split of us creating the opportunity for some of those high probability to come and begin working in those safety conscious jobs, but also begin developing those internship opportunities with Ivy Tech where they could have the opportunity to earn that livable wage. When we started down the path of creating the program, we believed that we would see about 75% in that low probability category and about 25% in that high probability category. And we found that it's really been about an even split, about 50-50 between high probability and low probability, which was surprising to us. As you think about potentially creating a program, there are other things that you need to think about depending on what works for your organization. So there have been more program costs than just treatment and drug screens, which is what you initially think of. There can be wraparound services. We've had situations where employees may not have driver's license, so we have to find transportation for them to and from treatment. We also have additional costs around those safety conscious jobs because they're not yet productive employees. And I think the last thing that's been that we've identified, this started as an opioid discussion for us, but we found that we don't want to just limit it to opioids. We allow anyone to participate in the program regardless of reason they failed a drug screen, and typically we find they fail for a cocktail of different substances. So that's the program that we've launched. Like I said, we continue to learn as we grow, but we believe we've created a program that can be a framework and can be scalable to other companies and across the Belden organization.
Thanks, Leah, for sharing your experience. Your initiative has garnered a lot of interest, support, and analysis, not just here in our state, but also from across the country. What has surprised you most about not only your local response, but also the national response to your initiative there at Belden?
Yeah, it's been really exciting for us to get such a positive reaction to the program that we've created. While we're extremely proud of it, it's been a bit surprising to us the level of interest that it's gained from both the state and national level. We view it still as a small pilot program, but we do recognize that it's a local issue, it's a national issue that many organizations are facing, and the struggle, they face the same challenges in recruiting. And I think ultimately the state and national governments are looking to employers to be part of the solution and really help in combating that addiction issue.
And with that, I will turn it over to our last speaker before we do some group questions and answers. Jennifer? See if Jennifer is able to join us.
Hi, this is Jennifer.
Great, Jennifer, thanks.
Can you hear me?
Yes, we can.
Okay, great. Thank you. Sorry about that.
Right.
So, Jennifer Fair, I'm with the Wellness Council of Indiana, and I'm excited to be here and appreciate the opportunity to be on the same call with Mr. McClellan and Ms. Tate when we talk about what's the opioid impact on Hoosiers, and specifically from my lens looking at what's happening in the employer space and how can we better equip employers to respond and be a part of the solution. So as I mentioned, I'm with the Wellness Council of Indiana, and we are a subsidiary organization to the Indiana Chamber of Commerce. And what we know is that to have a healthy workforce is critically important to the economic vitality of our state. And as employers, we have a lot that we can do when we talk about the opioid crisis. So when the initiative was launched, it was launched with the Wellness Council, the Indiana Chamber Foundation, and the Indiana Chamber of Commerce. And the governor has asked us to really understand the opioid crisis through the employer lens. And what we have found is that it's very different. There are a lot of community-based conversations happening. There are a lot of resources that are being directed to the systems of care and how individuals access care, but employers were still sitting at the table saying, but what does that mean to us? So as part of the efforts that we have undertaken, the Indiana Chamber of Commerce has allowed us to access their 25,000 constituents to better understand how we can get tools and resources in their hands. We want to make sure that what we are doing is not duplicating efforts in the community, but learning from organizations like Belden and others and convening all of those resources and best practices to disseminate through our channels with the Indiana Chamber of Commerce as a partner. The objective that we have is to educate employers as to what's available in their community and what the substance use disorder really is, disseminate the best practices and interventions that are out in the community, and making sure that, again, our employers in a situation where they can help identify individuals that are in crisis or individuals that are in need of services before it hits a crisis point. We want to raise awareness, as Jim had said, that recovery is possible, it does work, and we need employers to understand that diabetes is a very manageable chronic condition, and recovery should also be looked at as a chronic condition that can be managed. So the other thing that we're doing, and by the end of this year, we will be launching a survey to understand a little bit more about what employers are thinking around the opioid epidemic as it relates to their workforce. We want to make sure that we are taking resources and not duplicating our efforts. And we've convened a group of about 45 employers from across the state of all shapes and sizes to talk with them through a peer review panel so that we can get a better sense as to what does it mean, how are they accessing community resources, what questions do they still have. And it's been an interesting conversation because we understand that employers, it's not one size fits all. Every group is different. Every organization is different, just like every individual who is seeking care and working towards recovery is different. So we need to be able to understand all those aspects. And then we're taking best practices like Belden, like we're seeing in groups like FedEx and other organizations, and getting them to other employers so that they can learn from that. They can find themselves in that conversation and they can understand what their culture and their workplace will be able to tolerate or not. But what we have found is that there are some great tools through SAMHSA, the Substance Abuse and Mental Health Services Administration, the National Safety Council. The Ohio Chamber has done an amazing job in pulling resources together, and we're combining all of those under Indiana Workforce Recovery. And trying to get those resources out into the employer community by talking with other Chamber of Commerce organizations, other human resource organizations. We've got some information on the opioid impact in Indiana, and I'm not going to dig into the numbers because I think Jim has done a really nice job in doing that. But what we know is that the number of prescriptions that are going out in our state, those are staggering, and they continue to increase. And employers have the ability to impact that by the way that they manage their healthcare spend and the way they address not just opioids but their healthcare overall. So when we think about what can employers do, and I know Jim touched on this a little bit, as did Leah, but we want employers to make sure that they're looking at their data. So what data might that be? We want employers to go in and say, look at your pharmacy data. Talk with your insurance broker and say, I want to know how many prescriptions are being utilized by those that are covered by my insurance plan. I want to know how many opioids are being dispensed to my employee population. Use that data to help you understand if you have a problem. I am still sitting across from too many organizations, too many CEOs that are saying the opioid crisis is not impacting their workforce because they have a young workforce, highly educated, but what they are not understanding is that it is. And that if it isn't now at a place where they see it, it will be there soon. So look at the data. Make sure that the data, make sure that you understand that the data will tell a story. And what the story might be is that your medical claims are being driven through by musculoskeletal injuries in the workforce resulting in opioid prescriptions. You can, as an employer, you can do something about that, but unless you look at the data, you will never know the whole story. We want to make sure that when you look at your benefits, that it's a comprehensive coverage, that it is the EAP. Do you know who your EAP is? Do you know what it's like when an employee calls the EAP and what those services look like or feel like to them? Do you understand if your mental health coverage is comprehensive to the point where they can go out of state if needed for treatment, or is it limited? I spoke with one company who said that they look at mental health coverage as something that they trim a little bit to possibly save some dollars from a benefit design. But look at your plan. Do you know, is it comprehensive, and does it really meet the needs for your employee population? Look to see if you're looking at other modalities of care, and are they covered comprehensively within your benefits? Do you cover physical therapy comprehensively? Do you cover chiropractic care, or maybe acupuncture is something that you would consider, just so that we can eliminate the need for opioids and look at those other alternatives to pain medicine. But a lot of benefit plans do not cover those. So make sure that if you're thinking that you are interested in looking at ways to limit opioid prescriptions to your employee population, that you're looking at that. And then make sure that you understand your company policy. When we think about the number of employers that we're talking to and you ask, what is your policy on if somebody comes into the workplace under the influence or the suspected use in the workplace, what's the policy say? Is it a second chance policy, or is it immediate termination? And when you think about what that means to an employee, make sure that you understand that, again, it's a chronic condition. Would you fire somebody because they came into the workforce and their diabetes was mismanaged and they were not able to function at their best in the workplace? Relook at your policies to see maybe you're interested in being more recovery friendly and figuring out what you can do as a workforce or workplace to maybe not necessarily bring all of those individuals into the workplace that are struggling with addiction, but maybe it's understanding that you're never going to hire your way out of the opioid crisis, that you have to change your policies and your practices to support those in recovery. But by supporting those in recovery, it's not just about making sure that your benefits are in place. It really means that, does your culture accept those in recovery? Are you open in your communication? Are you helping individuals as they come back into the workforce be accepted? We know that when people are in recovery, that the social aspect of recovery is very, very important, and the workplace is a place where somebody could come in and should feel supported in their recovery process. So we want individuals to become more recovery friendly as they think about how they are able to be a part of the solution when it comes to the opioid crisis. We also want to ensure that employers can access the community resources for employee education. Employee education to raise the awareness, not just about opioid use and misuse and opioid addiction as a chronic disease, but maybe it's safe medicine disposal. You know, do you know how your employees are accessing their medicine? We know that a lot of individuals begin the addiction of opioids by taking medication out of somebody's drug cabinet in their bathroom. How can we help people eliminate that and dispose of them properly? And there are tools that are available. We have disposal kits that we can make available to employers if they're interested in doing safe practice in disposing of medications, or maybe there's a community partner through either your sheriff's department or a local pharmacy where you can just educate your employees on how to properly dispose of those medications. The other thing is when we think about what employers can do to be a part of the solution in the opioid crisis is make sure that they are educating their employees about, you don't have to take a prescription that your doctor gives to you. Yes, we're not going to ask you to be making medical decisions, but we know that dentists, for example, often we hear of instances where individuals are leaving with a large number of opioid prescriptions, and what we have the ability to do is to educate our employees that when you go to the dentist, ask if it's necessary, ask why it's being prescribed, ask if there are other alternatives as opposed to an opioid prescription, and educate your employees to be good consumers of health care, and that includes their prescriptions as well. We also feel like there are so many resources that are available in the community with the next level recovery resources that Jim alluded to. We want individuals to go back and understand that hiring and retention practices are impacted by the opioid crisis, and what we want you to do is understand, what does it mean? Are you willing to go to the level that Belden has gone to accept somebody in recovery? Do you know what your drug screen process looks like, and are you screening for all opioids? Do you know that if the failed drug screens are because of opioids, or maybe they're because of marijuana, and what's happening within that information? How are you using that? And we want individuals to understand and employers to understand that there are so many options for recovery out there that your employer could be and should be a partner with you in recovery, and we want them to be able to access the treatment programs that are available as part of their benefit plan design. So I know that there are lots of things out there that the employers really can do, but understanding and accessing and making sure that you have available through your HR communication access to the Indiana Next Level Recovery Treatment information. There's information on the Indiana Family and Social Services Administration site as well on treatment locations and the types of treatments available. And if you have somebody in the workplace, we want employers to provide the hotline from the Indiana Division of Mental Health and Addiction hotline so that your employees have the opportunity to access the appropriate levels of care when needed. And I apologize, I kind of flew through all of that, but at the end of the day, what we want employers to understand is that they are part of the solution, and employers have a lot of tools and resources that are available in the community, and we're here to help make sure that if you are seeking out those resources, that we can help you find them. Thank you.
Thanks, Jennifer. We know that the top concern for companies right now is finding and keeping talent, and you kind of touched on that with retention. If you had to distill down, how would you say your initiative is responding to or relating to this well-known business imperative?
So when we see individuals that are trying to hire or retain talent when it comes to the opioid crisis, what we want employers to understand is that, as I mentioned, you're never going to hire your way out of it, so you have to rethink about your policies. And to have a policy to have a workplace that is more drug-friendly in the workplace, you will be able to open up a wide variety of places where you can seek out employees to fill some of those hard-to-fill positions. For example, we've seen some companies that they bought a bus that they go around to different parts of the community to pick up workers and bring them back. And one of the locations that they have gone to seek individuals in recovery is the homeless shelter. They literally take a bus to the homeless shelter every day and pick up individuals that are in recovery but are trying to get started, restarted, and being independent, and they take them to and from work every day. And in your general way of thinking, most employers aren't going to think that way. So we want individuals and we want employers, when they're trying to hire staff, to think outside of those normal avenues to find employees. And don't be afraid of it, but just understand that it's more than just a policy. It has to be part of the culture and the leadership that Leah talked about, that commitment and that leadership to make something like that happen.
Great, thank you. Well, we're going to move to all three of you were gracious enough to allow me to ask you a few follow-up questions. Leah, I wanted to start with you. Can you share a bit more about how you made the case and continue to make the case to Belden's corporate leadership? I'm sure many companies who will be listening to your story today will have that question about how do you go about generating that buy-in?
Yeah, so we're obviously extremely fortunate to have a senior leadership team that's been supportive, given us the flexibility to develop a program that made sense. We have a culture of continuous improvement as a way of life, so when we started digging into some of the root causes around our hiring issues, the biggest spike that came out of that analysis was applicants failing drug screens. So I think it was presenting a case of data of what we saw going on. They saw and understand and were frankly disturbed and alarmed by some of the statistics around addiction, and so we're extremely supportive to provide us the ability to put together a program that could have a positive influence on the community. We even got support up to our board of directors, so it was an issue, a challenge that was discussed with the board of directors, and one of our board members actually put us in contact with an addiction expert out of New York, Dr. Mitch Rosenthal, and he helped kind of help us guide us through the challenge and thinking about how we created a program or developed what ultimately became Pathways to Employment. I think the biggest thing for our senior leadership team was creating a program that would make a difference, but also ensuring we were able to create something and show to them that we were still able to maintain a safe working environment for those employees that were coming in, but our existing workforce.
Great, thanks. And Leah, you kind of touched on this earlier. Company values are often best drawn upon when there's difficult times, like the workforce shortage we're facing, as well as then being exacerbated by the addiction epidemic. Was this true in Belden's case, and what were some of the long-standing values of Belden that you were able to draw upon when crafting this program?
Yeah, so our corporate strategy really revolves around 3 key pillars, and that's employees, customers, and shareholders. And I think this program really impacts all 3 of those. Investing in current and future employees had a great impact on employee morale. So our engagement from an employee standpoint, I think obviously being able to staff openings and continue to maintain production in our plant impacts our customers and shareholders. But from a value standpoint, I think there are 3 values that I would point to. I talked earlier about continuous improvement as our way of life. So really getting in and digging into the issue and understanding and trying to find a way to come up with something that would solve the problem. And then continuous improvement as we go, continuing to understand maybe how the program's running and what we can continue to do to improve it. We reach for greatness as a value at Belden, and I think that's really around creating innovative breakthrough performance, and I think we at least believe we've created an innovative program that we think, for us at least, is a breakthrough. And then the last value I would point to is we invest in talent. And so I think we're investing not only in our future employees, but we've had, Jim talked about the stigma that comes along with, and I think our program has started removing that stigma, and we've had existing employees come forward and say, hey, I have a problem. And so we've entered 3 of our existing employees into the program. So I think it's really about investing in talent, both our current and our future.
Thanks. Jim and Jennifer, if an employer wants to share their insights and experience with lawmakers, what advice do you have for them? And how can they add this to the public policy debate that is happening about how to respond as an employer? Jim, I don't know if you have any. Yep.
Yeah, I would just suggest meet with them, call them, email them. I think you'd find the vast majority of our legislators be very responsive and would want to hear from you. So I would strongly encourage you, if you have ideas or concerns that the legislature needs to be aware of, to contact those who represent you.
Thanks.
And I would echo that, Jim. I think that's definitely a great place to start. And I think, like Belden, I think it's if you have a story to tell, tell it. Tell it to everybody that will listen. Tell it to your local legislators. Tell it to the local media. Share the stories in the HR circles, because everybody is looking for a solution, and everybody, but nobody understands your unique situation. So if you have a story to tell it, and if you have a story that you need help telling, we can definitely, we love to share the success stories, and not just the success stories, but the stories that have some type of a learning. Reach out, and we can help you tell it to the right people as well.
We're getting close to our hour, but I wanted to kind of end on this note. For all of you, I want to zero in on the cigarette tax and the impact that could have on our future workforce. For purposes of this discussion, we know the tax will generate approximately $360 million in the first year alone for urgent health-related causes, including opioid prevention and treatment. Jennifer, I'll start with you. Why is this policy change that we're seeking so important to you from where you sit?
Well, where I sit, the Wellness Council of Indiana is really here to ensure that employers have a healthy workforce. And we know that smoking is one of those key drivers and negatively impacting our state health metrics. So it would mean a lot to us to make sure that as we go out there, that when we look to recruit new businesses into the state of Indiana, that we have a healthy workforce to offer them.
Jim, do you see an opportunity for new revenue to make a difference? And if so, any thoughts on where and how that might be best targeted?
Well, we certainly see plenty of opportunities where new revenue can make a difference. Additional prevention, evidence-based prevention programs for children and youth. And by the way, and this is consistent with something that Leah said, it's not just substance abuse related to opioids. It's all substances. We want to do as much as we can to delay or prevent the use of addictive substances by kids just as long as we possibly can. But in addition to that, increased access to medication-assisted treatment, more recovery supports, including recovery housing. And in fact, some of the new money that the state is going to be getting from the federal government through the new statewide opioid response grants, we're going to be using for some of those kinds of purposes. But there's no question there are plenty of opportunities for new revenue to make a difference in this struggle.
Well, we can often get stuck sometimes on the negative when it comes to our Hoosier health metrics, but I'd love to end on a positive note with all three of you. What gives you hope, and what is one call to action for business leaders, something actionable they can do? Leah, if it's all right, I'll start with you.
Yeah, I would say my call to action is find out what works for your organization. Reflect on your existing company values. Work with your leadership team to see how you as an employer can make a difference.
Thanks. Jim?
Well, what gives me hope? Some encouraging signs that reassure us that we're on the right track, and the growing number of people who recognize opioid use disorder as a chronic disease and who want to help. And then a call to action, I would say learn as much as you can and help educate others about substance use disorders, help to further reduce the stigma, and see how you might play an active role in local coalitions wherever you might be, local coalitions that are focused on prevention, treatment, and recovery, or at least if you can't take an active role, perhaps you could provide financial support for some of their initiatives.
Thanks. And Jennifer?
I think that what gives me hope is that conversations like this continue, and the more we have these conversations, the more stories that we hear of success and opportunity. And the call to action for employers is to let data drive your understanding of how opioids is impacting your workplace, and use that to develop your own solution that's going to work for you.
Well, thank you, all three of you, for all the work you're doing in this arena, and can't thank you enough for your partnership, and appreciate you being with us today. Thanks so much.
Thank you.
Thank
My
you.
pleasure.